Hi, I'm Dr. Laura Cisneros. I'm the actual president of the Mexican Hepatology Association. I'm going to talk about the hepatocellular carcinoma in Mexico. The hepatocellular carcinoma is the most frequent malignant tumor of the liver. It's associated with cirrhosis in 80% of the cases. It's the third cause of death related to cancer in patients more than 60 years and is equal incidence in men and women. And the incidence is increasing annually. In an epidemiological study from hepatocellular carcinoma in Mexico, we found that the more prevalent etiology was alcohol abuse next to hepatitis C virus and not alcoholic steatohepatitis, and is associated with diabetes in 42% of the cases, and hypertension in 70% of the cases. More recent publication has noticed that NASH is going to be the more frequent cause of chronic liver disease in Mexico. And this is secondary of the obesity epidemic, because the 72.2% of the population has overweight and 36.6% of the population has BMI more than 30. Mexico is the country with the second place in obesity in adults and the first place of obesity in children. In another study made in the north part of Mexico, we found a very significant association between the PNPL3 gene with the polymorphism, the two different polymorphisms that when it present in the GG variant, the homozygous GG variant, increase the incidence of hepatocellular carcinoma. Another carcinogenic in Mexico is the aflatoxina, that B1, and this is considered agent to humans, carcinogenic agent to humans by the International Agents for Research on Cancer. This compound contaminate different products, aliment products, by a fungus, the Aspergillus flavus and Aspergillus parasiticus. And when this food is contaminated with cereals, corn, tortillas, and oil seeds, and different products are contaminated with this fungus, increase the risk of hepatocellular carcinoma. These both things that have mentioned in advance are currently in research, in investigation. Related to the treatment is the same than the rest all around the world. But the treatment, we noticed that the 80% of the patient comes in very advanced stages, and these stages are not curative. We have the possibility to give to the patient curative treatment with the surgical resection or liver transplantation, but the fact that the patient comes in very advanced stage and lack of cadaveric organs limit the possibility of make it resecable. The most of the tumor comes more than 5 centimeters when they, in the 67% of the population, when they come to see a doctor. Better surveillance strategies could be required to diagnose this patient in an early stage. Thank you very much for your attention.